I want to thank you very much for letting me be here. My name is Chris Fitzsimon. I work for NC Policy Watch, which is part of the North Carolina Justice Center, and I'm going to take just a couple quick minutes to set the stage for the panel discussion to talk about mental health reform and its effect on the workers, on you, folks who take care of people every day who can't take care of themselves. There are many words and phrases that I always think of when I think about the impact of mental health reform, and most of them I can't say before a family audience this evening. But I was in the legislative halls when it began in 2001 and even before, when the groundwork for it was being laid, and I've thought back to what was happening many times, and I want to talk briefly about that and then talk about what you face as workers. You know, the system wasn't working perfectly back in 2001, far from it. The state was relying far too much on the institutions that you work in. Services in communities around the state were uneven. Many of you know this a lot better than I do, and the thought at the time was a good one. It was in everybody's best interest, especially people with mental illness and their families, to create a new way to do things, a new structure, to treat people in their communities instead of institutionalizing them in Raleigh or Butner or Goldsboro or Morganton. So far, so good. I think we all agree that was probably a good philosophy. The plan was built around the assumption that communities would also get the resources they need to provide the services when people left the hospitals. So they set up something called the Mental Health Trust Fund. The plan also set up something called local management entities, LMEs, that would coordinate all those things but would not provide services themselves, and that's very important. The LMEs would work with private service providers, profit and nonprofit, to help people with mental illness, a developmental disability, or substance abuse problem. Now, most of you know what happened next. Much of the money that was promised to the communities never materialized. Governor Easley took most of the money in the Mental Health Trust Fund when it was set up to balance the budget in 2001 and 2002, and it's never really been replaced. The LMEs have operated with little oversight. Some do okay, some are disasters, and people's lives are affected. All that is the background. That's just a brief summary, and it's just the background for what has been happening to people's lives in the last 6 years and what I want to talk to you about very briefly. Despite the best efforts of some people on the stage and in state government, people are still being discharged. You guys know this. People are still being discharged from mental hospitals into homeless shelters. In many areas of North Carolina, families face long delays, confusing instructions, and all kind of bureaucratic, crazy mazes trying to get their mother or daughter or son or father service. Sometimes 4 or 5 different companies, for-profit companies, treat one patient. Sometimes a person with mental illness finally builds up trust with a caregiver, and then that company goes out of business and the caregiver's gone. And now we move to the hospitals. Something else indeed. Now, the News and Observer's a lot of people are talking about the series that was just published recently that you all know about, but I want to talk about the one that was published last year. The one that detailed the revolving door admissions at the hospitals and discharges that prompted the federal investigation that you know about. It convinced some grieving families who have now filed lawsuits that their loved ones' suicides were partially the result of a hospital's rush to discharge them back to communities that had no services to help them. Former mental health director Michael Mosley told the News and Observer last year that what happens after patients are discharged is not the hospital's fault, which is true, that the problem is lack of services at the local level. Think about that. The article made a convincing case that hospitals' admission and discharge policies are questionable at best, but even if Mosley was right, his comments always strike me as outrageous. He ran the department that was supposed to make sure people got the services that they need in the hospitals and the communities, and if people were dying, he should have been at the General Assembly banging on Verlinsko's table and all the legislators' table, and banging on the governor's table until the money was there, not shifting the blame around while people were suffering. The federal government, as you know, cut off funding for Broughton Hospital after problems, threatened to do so at Cherry. And in case you're wondering, as you all know, though, the new hospital being constructed in Butner, the one that's supposed to make it possible for Umstead and Dorothea Dix to close, is scheduled now to open in July. It's going to have an overflow wing because they're already forecasting more patients than the hospital can handle it. How's that for planning? When I talk about mental health reform, I always describe the efforts as well-intentioned, and I think they were, even if they went terribly wrong. I still tend to call that 2001 plan well-intentioned mental health reform, but I can tell you that a lot of people I run into every day when I talk about this who are dealing with the daily realities aren't so sure the people who have been in charge for the past 7 years are well-intentioned anymore. And that brings me to my last point, and the most important one for this evening. Anytime people lose faith in a system, you have a crisis, and people have lost faith in the state's mental health system. And for the past several years, they heard very little from our administration about their plight. That's changing some, thank goodness, due to the efforts of the legislators here, Secretary Dempsey Benton. They're working hard to straighten things out, and thank goodness they're starting to step back from the perils of privatization, which is the fundamental part of reform that we still don't want to talk about, turning things over to profit instead of people. But what about the workers? What about you? What about the workers? That's the forgotten part of mental health reform. It's why I'm proud to be here with you tonight. What about the workers? You all know better than me, but I get emails every day. Turnover at the hospitals is high, morale is low, and pay borders on the disgraceful. The new hospital is supposed to open in a little over a month. The patients are coming, but there's not enough staff to take care of them. Plus, we got to hang that portrait on the wall just right. Now, state officials are telling us they're going to fill those jobs at the new hospital with temporary workers. Temporary workers, that's no solution. What about better pay, more respect, and better treated permanent employees? The latest version of the House budget, which is now under consideration, does include money to reduce the staff-patient ratios at the hospitals. That's a start. I think we should thank the legislators who are here, but ratios don't pay the bills or help people figure out how to afford the gas to drive to Butner every day. I am always amazed at all the talk about expanding services, improving services, extending services. We need to do that, but services are people. Services are workers, services are employees, services are human beings, mothers and fathers and sons and daughters. We need more services, and the only way to provide them is by paying and respecting the workers who do the work. The House budget, one more point, the House budget provides a 2.75% raise next year, or $1,100, whichever is greater. And I know times are tough, and I know North Carolina's doing a lot better than other states, but 2.75% won't do it for the kind of dangerous jobs that you all do. And I know I'm supposed to only be setting the scene, but I'll leave you with this. The answer to the problems faced by you, the workers in our hospitals, is not 2.75% of anything. The answer is a Bill of Rights for workers, and the answer long-term is for you to be able to speak with one voice, to collectively bargain for your pay, your benefits, your safety, and your dignity at work. That's the answers. Lawmakers, however well-intentioned, can't understand what you face. They can't speak for you. They can't speak for you, and neither can I, and would never presume to. But lawmakers can take off that muzzle that prevents you from speaking together with one voice, that prevents you from bargaining for yourselves, for your families, and the people you help every single day. Thank you for letting me be here, and thank you for what you do every single day. Thank you very much.